Cherie's Senior Showcase is on the air. Cherie's Senior Showcase on WRMN AM 1410 and 96.7 FM is an informative and fun show that features events, resources, and news that Elgin seniors can use as a guide to help them get the most out of the golden years. Senior Showcase also features trivia, games, and prizes. So pick up the phone and participate today by giving us a call at 847-931-1410. That's 847-931-1410. Today's program can also be viewed and commented on by going to WRMN 1410 Radio on Facebook. Seniors, don't forget to mark it on your calendar to listen to this show on the third Tuesday of each month at 9:15 a.m. And now, we welcome you to Studio 14 in downtown Elgin as we introduce our host for Senior Showcase, Cherie Aschenbrenner.
Yes, it is time for Cherie's Senior Showcase on this beautiful, hot day here in Elgin. And let me get our guests and myself on camera here. And there we go. We are off and running on for this edition of the show. And Cherie, it always seems like it hasn't been a long time since our last show together, but you've let me know today that a lot of things are new around here. So I guess it has been a little while since the last time.
Studio for me.
Yeah. Well, welcome to the studio today.
And now I'm a senior. My birthday was Sunday.
That's right.
Yeah.
Happy birthday.
Yeah,
Happy belated birthday.
6-0.
Yeah.
Do you believe it? I'm 60.
I
I'm
know.
finally a senior.
Can you believe it?
No.
You're finally. Have you been waiting for this day?
No.
When will I finally be a senior?
And here I am.
Yeah.
So, we went away for the weekend. We went to Cedarburg, Wisconsin for 2 days, and I haven't been anywhere in a year and a half, so it was nice. And it actually felt like I was gone a week, so I guess that's good.
Yeah.
God, it was nice.
Yeah. Well, happy birthday. I'm glad you had a good time.
I did.
What's in Cedarburg, Wisconsin?
Oh, it's kind of like a little Galena.
Is it?
Yeah.
Oh, cool.
Just some little towns and shops and food.
Yeah.
So that's kind of what we did. It was nice just to get away for 2 days.
Well, you're back and you have a show planned today.
I do. We got good guests today.
Yeah.
But before we introduce them, I am going to real quick go over a couple of things. Everybody knows that if you want to get on my senior email list, I'm up to 1,780 now. All you have to do is call me at 847-289-2626. Just give me a buzz. I'll put you on. You'll get all these flyers and information that Mark reads a lot on the radio, and it's all senior stuff related that it would apply to you. So definitely get on my list if you can. The Elgin Township Triad Picnic, everybody's waiting for that. You've got to mark your calendars.
Yeah.
It is June 27th at Panton Mill Park in South Elgin. However, we take the first phone call at 8 a.m. on June 3rd.
Yeah.
God help Elgin Township and those three ladies.
it's like getting concert tickets to go see Taylor Swift or something.
It is. Yeah.
The phones start ringing off the hook right off the bat?
Yes.
Wow.
8 o'clock. 8 o'clock on June 3rd. We're only taking the first 200.
Only the first 200.
Yep. And we'll take 30 on the wait list.
Operators will be standing by 8 a.m. June 3rd.
Yep. Poor Jeanette and Claudia and Nellie.
Nellie? Okay.
Yeah. So they'll be waiting. Yep. And then we'll take a list of 30 for a wait list.
And call 847-741-2045.
Correct.
Right?
That's correct.
Yeah.
Yep.
847-741-2045. When is it again?
June 27th.
Okay.
At Panton Mill Park, 11 to 2. And, of course, the Elgin Police will be there, South Elgin Police and Kane County Sheriff. So.
And it's being moved up from its previous date,
Yeah,
right?
last year it was the last week in July, and we almost died. It was like 93, and it was in the shade.
Yeah.
Oh, my gosh. We had to cut it short a half hour. It was so hot.
It's going to be a good effort, but it could still be hot on June 27th, too.
I don't know where it's going now, right?
Yeah. It's supposed to be a really hot summer, I think.
I'm glad it's better probably in June. So, all right. So that's coming up. So June 3rd, mark your calendar. That's the first day that you can sign up. We always have our Elgin Area Memory Cafe. We had Steve Knight there this month, and he brought us 15 birdhouses.
Yeah?
Everybody in attendance got one. God, they loved them. They're just so nicely made, and he had a good time talking about his organization.
He's the birdhouse man.
Mm-hmm. Yeah.
So he brought one for everybody that was there?
Yeah, well, Elgin area, dementia-friendly Elgin area, we bought them from them, and then we gave them to our people.
Oh, nice.
Yeah.
That's cool.
It was really fun. So we had 40 there again. It's amazing. It's always the second Tuesday of every month, 4 to 5:30, and you can just bring your person if you can, if they would like to come with, or you can come by yourself. It's just a nice little hour and a half of getting together.
At what used to be Stanley's and is now El Flaco.
El Flaco's, yep.
But it's the food's different, but it's the same setup basically.
Yeah, it is. And we have our own room in the back, so it's nice.
Cool.
And then Medicare made ABCD easy. They have their own show here.
Yeah, first Tuesday.
They got a couple of locations both in Elgin. Wednesday, June 12th, they're going to be at the Rayco branch, Gale Borden Library, Rayco branch on Bowes Road. And then Tuesday, June 18th, they're going to be right here, center of Elgin, talking about ABCD plans and prescription drug plans and Medigap plans and all questions. It's about a 45-minute presentation. So you just have to call them, and I'll give you the number. It's 630-320-6906.
Good information, 630-320-6906. And I'm surprised, pleasantly surprised by how many times I get a phone call from somebody that's listening to that show that wants their number. Maybe Danny doesn't say it enough on their show.
Right.
He wants their number from me. So good advice from those.
It is.
Yeah.
It is. And they don't sell. They're not. They are a broker of the programs, but they're just such good information to get you to where you need to go.
Yeah.
So that's what I've sent some people to them too, and they've got good feedback.
Yeah, cool.
And let's do two more things here. AARP having that 2-day driver class again. It's going to be at Elgin Township, and that's Wednesday, June 12th, and Thursday, June 13th, 9 to 1, both days. You got to go both days.
Yeah.
The 2-day, and then you get a little discount on your car insurance.
Can't get half the credit for half the discount.
Nope.
You got to go both days.
That's right.
Okay.
847-741-2045. Again, call Elgin Township. They have 6 seats left.
Oh, really?
Yep.
Okay.
Yeah, they take 16. They're at 10, so 6 seats left.
Okay.
And then don't forget, Movie Day is going to be in June 13th, the Elgin State Bank's Movie Day. It's at Marcus Theater. Doors open at 8:30, 9 o'clock. Their little meeting begins. June 13th is a Thursday. I won't know the movie yet until about 3-4 days before that.
Yeah. All right.
But I send that information out as well.
You send it out, and I believe the number for that is 847-888-7976.
You are.
How about that? I'm on a numbers roll today.
You are a numbers man. I'm impressed.
I have no idea how I know that. 847-888-7976.
You never even been there.
I know.
And you could, because you only have to be 50
Yeah.
to attend that one,
Yeah,
Mark.
yeah.
You can go to that.
Yeah.
Okay, so we have our guest today, and I have a doctor in the house.
Cool.
This is Dr. Elizabeth. Now, we were saying, I heard you say, how do we say her name?
Yeah.
It's Kayode.
Kayode.
Kayode. With a D. Kayode.
That's what I said.
Yeah,
Yeah. Okay, good. I was right.
Yeah. So, and then we're going to move on to the other Elizabeth. I don't know if you can see her over there.
No, we can't. We should. She has a nice smile.
She is doctor's support.
Okay.
Okay. From Advocate.
She's in
Okay.
the background. She's not on the YouTube camera right now. Yeah.
We'll put her picture on. I'll put it on my Facebook page.
Okay.
Anyway, so doctor,
Yes.
I was talking to you a little bit before, and do you know what? Homegrown right here.
Yeah, how about that?
Homegrown.
Right.
She is an Elginite.
Went to South Elgin High School.
Correct.
Yeah. Tell us a little bit. What did you say? Where'd you go to school here?
Sure.
Your grade school, middle school.
I'll do the whole background.
Yeah.
So I actually was born in Arlington Heights,
Okay.
but then my family moved to Elgin. From about preschool till, let's say, up to middle school,
Yeah.
we went to a private school, Schaumburg Christian School.
Okay.
And then from there, from 10th to 12th grade, I went to South Elgin High School. I did my bachelor's at University of Illinois in Urbana-Champaign, ILLINI. That's my favorite alumni place. I really miss that college, but it was a great experience. So I went there for undergrad. Then for my medical school, I went to a Caribbean island called St. George's University in Grenada. After that, I did my residency in Michigan, Livonia, Michigan. And it's funny how you all are talking about, the senior. That place is known to be very heavy geriatric population. So I dealt with a lot of elderly patients there.
Really?
Yes.
I like that.
Very heavy in that.
You're hearing,
so
I hope.
I'm heavily trained in that.
Listen up, seniors.
Yes.
And
So then I decided after I was done with my training, I'm like, I want to come back home. So Elgin is home for me. So I decided to
Isn't that
come back
something?
home.
So you're at Advocate.
Correct.
Sherman over there on Randall. But where's your office?
1710 Randall Road, so literally right across Sherman. So it's literally not far from there.
Okay.
Right across.
And so what made you decide you wanted to be a doctor?
Actually, my inspiration was my own family doctor when I was little.
Really?
He took care of myself and my whole family, and my mom reminded me of this, and I always remember this. When I was 6 years old, I was going for my first checkup, and he was holding the stethoscope in my heart, just listening to my heart. I was just looking at him. I said, I want to be a doctor just like you. He just looked at me and smiled. And since then, I never looked back. So he was my inspiration.
Wow. Since 6 years old.
6 years old. Yeah.
And you did it.
And I did it.
So how long have you been a doctor?
So by August, it'll be a year. So I'm still fresh out. So I am still looking for new patients. So if anyone needs a doctor, I'm available.
1710, nice and close. And she works with seniors.
Yes.
There you go. So our topic today, and it was so funny because Mark, I knew the topic, but I get this in the mail, and it was from Advocate Health Care.
Yeah.
And it's like, where to go? Like, how convenient is this? It just came in my mail.
Oh, wow.
Yeah, a couple of days ago. And it talks about the right care, where and when you need it. So we were going to talk about that today because people, like you said, they're not sure. Oh yeah, I got a stomach ache, or I don't know, maybe a UTI, or I got a rash. Do I go to Sherman and sit there, in the emergency room, or do you try to look for an urgent care and sit there? I mean, I'm not really sure because I know that the urgent care by me now, McDonald Road, is moved, and boy, that I went over there for blood work in April. I cannot believe how huge that one is. I kind of missed the one right at Randall and McDonald because it was. But this one's a little harder to park at, but it's big.
It's huge
So,
right here.
So, okay, so let's start there. So, when do you go to urgent care? When do you say, you better just go straight to ER?
Yeah, so that's a good point. So, first things first is a lot of the symptoms one may have. The first thing is it's best to actually call your primary care physician to discuss first. For example, let's say, like you mentioned, you had a stomach ache.
Yeah.
That's something a primary care physician can take care of in the office.
But you can't get in.
So that's the thing. I was about to go there. But if you call and they say that, they don't have any available appointments.
Not today.
At that point, then it's good to go to the urgent care. That's when you want to go to the urgent care for further evaluation. Urgent care is like a middle ground between a doctor and an ER. Let's just put it that way. It's like a middle ground.
Right.
So a lot of times, if it's something that you're not able to see your own doctor for, then the best thing to do is go to an urgent care for further evaluation. But there are some symptoms that may be severe that right away don't even think about going to an urgent care. You need to go to the ER. Right. For example, chest pain, difficulty breathing, episode of seizure, wanting to faint, things like that. Don't even wait to go to the urgent care. Right away, call 911 and go to the ER right away.
Yeah, because I know when you go to ER for that kind of thing, they get you right in.
Oh, yes.
Anything with the heart or something breathing, they're not messing. You're not going to sit there. But I know and a lot of people are like, but if I got to go to, and I've been in the ER with other people, and you're going to plan on 4 hours. You're going to be there.
The wait.
With the wait, and then and then if they got to run tests, and then you're going to wait and get those back, and then you got to run some more. So it is a long process, and I think that's why people like to just try to go to urgent care if they can squeak it in. But but I don't know that they have all the equipment there.
That's the thing. So that's why anything severe, it's just best you go to the ER. It would be a waste of time to then just go to the urgent care, and at the end of the day, they may say, this is something you need to go to the ER, so then it's like a,
Yep, and then you got to wait there.
Exactly.
Then wait again. I get it. Now, that new one that is on McDonald and Randall, kind of by the TJ Maxx. Now, what is new over there that it's so huge? You got, is there more equipment there?
Yeah, so it was newly built. It was just opened in January.
Yeah.
So yes, they have new lab facility. There's some primary care doctors there. There's some specialists like orthopedic doctor, endocrinologist, someone that deals with diabetes management. If you're on insulin or thyroid issues, he's over there. And I know there's some other specialists there too, but those are the top two I know for sure that over there.
Do they do more tests there? Do they do like mammograms there or CT scans?
I would believe so, yes. Yeah. They should have location for that there as well, yes.
It was
as an option, yes.
Yeah. I had just go, like I said, blood work. I went at 7 because they open at 7. I was out at 7:12.
Nice.
Loved it.
Very
Loved
quick.
it. Yeah, because you still get to work.
Yes.
No. Yeah. So
that's really nice.
Okay, so they were talking about the yellow zones, and the red zones. So other things for a red zone. I mean, if you obviously anything with chest pain, anything where some kind of a serious burn or serious stomach ache. Says any kind of like trouble breathing or uncontrolled bleeding.
Yep.
Shaking, seizures, maybe if you've had poisoning, that type of thing. Yeah, you need to go right to the emergency room or call 911.
That's correct.
Yeah. Now, there were some other things they said. You could go to, what's this telehealth thing where you can call your doctor on a phone? Is that?
So for, some seniors that are tech savvy, because I know not all seniors are, but the ones that are, yes, there are some that you could do telemedicine. So
Okay.
for those mainly are for like colds. So for example, if you're having a sore throat, if you're having runny nose, things like that. Mainly colds is best to do telehealth if you're not able to go in person. Some also
get a ride.
Yeah, for sure. And there's some that actually allow you, if you have like urinary symptoms, let's say if you have a urinary tract infection, some may do a quick visit for that as well. But majority of times it's colds and things like that you can do
Sore throat,
telemedicine. Correct.
Don't feel good.
Yeah.
But so what would you have to do when you do that? You call your doctor, your primary doctor, but then they would tell you that your doctors can do these at a certain time. You get an appointment for that then?
So if you decide that you want to see your own primary care doctor, yes.
On the
On the telehealth.
Yeah.
So the telehealth, there is an actual number. I believe it's like it's called quick. It's like a quick care video visit that's 24/7.
Oh.
So it's something you will have to look on the website for that.
Okay.
Quick care visit. That's completely different from calling your doctor.
Yeah.
Yes.
Oh, so you would just get any doctor that would be
correct.
on that.
Any provider.
I see. Yeah.
Correct.
Because I was gonna say you're not gonna talk to your doctor.
Yeah, you know.
No,
No.
you know, and everybody knows it's getting tougher. To try to get in if you
It
have
is.
something wrong. You call your doctor, you're gonna be lucky to get in, and unless they have some cancellation or
That's correct.
I know. And it's harder to find doctors too.
Yeah, that's why I'm available.
Here we go. I like it. So I don't know. It's hard too for some of the seniors that they always want you to pre-check in now too. I mean, if you don't have, if you're not like you said, if you're not don't know how to work the computer very well and you're not really sure how to do that. I mean, you can do that when you get there.
Exactly.
But you're going to sit there with the clipboard and the paper. This way, if you can pre-check, they'll send you an email, pre-check in, then you got to log in. But then again, you've got to have the apps and you've got to have, like Sherman Hospital has the
Live Well.
Live Well app. But you know what? I like that app because it's got, you can have your blood test results the same day. Your doctor will call you a day or two later. I'm like, yeah, I already know.
That is true.
It's right there. It's
That
right
is
there.
true.
Yeah, I like that. And then it has your doctor appointment reminders, or if you have memory, all that's on there that's coming up. So I do like that app, and I like it all in one spot.
Yes, and you can also communicate with your doctor that way as well.
Oh, you can?
So, for example, if you have like a concern or is this like maybe a quick question, there's an e-advice where you can just type your message and then it will go through the portal and then it will reach the primary care doctor and then you'll get a response back.
Oh, okay.
Yeah.
So now you are at 1710, and then there's a lot of doctors in there.
Oh, yes.
All the ones are in there.
It's a huge facility. I believe there's total about 14 or 15 of us total.
Okay. All right.
Yeah.
Now, if you went to see you and then couldn't get into you, now are you in with the other doctors too? So they'll say, well, you're busy, but you could see Dr. blah blah blah.
So a lot of times, what happens is if someone calls to schedule an appointment, if I'm unavailable, we do have nurse practitioners that can see patients on my behalf. But if they do prefer seeing a doctor instead, then they will have to look into other doctors' schedules to see if they could, accommodate them.
You'll have a nurse practitioner.
Yeah, but we do have nurse practitioners in our office, yes.
There seems to be more and more of them, if I've noticed when I was looking on your sites. I cannot believe how many there are.
There's a lot. There is.
But can they prescribe medicines?
Yes, they can.
Okay.
They can. They can prescribe.
So what is the biggest difference then between a doctor and a nurse practitioner?
Is the training. So as physicians, we have 4 years of medical school plus minimum 3 years plus, depending on the specialty, 3 years minimum of residency. Whereas a lot of times nurse practitioners is, let's just say, about 2 years.
Okay.
If you're going to like nurse practitioner school, about 2 years. Of course, some may have 4 years of nursing school and then decide to do nurse practitioner and do 2 years. But training-wise, as doctors, we have way more.
Okay.
We have more training.
But if they went in with a sore throat, they could.
Nurse practitioner can do that.
They
too.
could do an antibiotic for.
They can do that. Correct.
Okay.
If needed. Yep. Yes, they can.
I'm just checking with Mark. Do you have any Any questions or I'll just interrupt us?
At the moment, no.
Okay.
I'm good.
Okay.
Good conversation. But I will say this: we can take phone calls.
Yeah.
And I don't think I've given the phone number out on the show yet today. So if you want to call, it's 847-931-1410. 847-931-1410 to be a part of the show if you have any questions for the doctor today. Or I'm also checking YouTube at WRMN Radio on YouTube, where we have Wilma checking in and says, "Hi, Cherie and guest."
Okay.
And we also have Annabelle Lara checking in, says, "My husband's turning 60 in June. I guess I'll be married to a senior," says Annabelle. And my old classmate Mark Ellis checks in. He's listening from Phoenix, Arizona this morning.
Wow.
While he's in town for business in Phoenix, I guess, he needs the feel of his hometown, so he's listening on YouTube today.
Nice.
So,
That's
yeah.
nice.
So that's what we have so far, 847-931-1410, if you want to join us on the radio.
Okay.
Yeah.
All right. So we have a couple other questions we were going to talk about. Like one of them was, why is it important for seniors to have an established primary care physician? That is a good question.
Yeah.
Why should they have a doctor? They need a doctor. I mean, what do you have? They always say, even if you go to urgent care, follow up with your primary. You need a primary.
Yes,
Okay.
because you want to have that comprehensive, continuous coordination of care. That's why it's really important to see a primary care doctor. Preventative screening. So by you reach a certain age, mammograms are important for screening of breast cancer. Colonoscopies are important for screening of colorectal cancer. When women reach 65 and older, the increased risk of osteoporosis, so decreased bone density. So it's something one has to screen for that, and if God forbid one has that, we need to take the necessary precautions to prevent it from worsening. So, normal preventative screenings, vaccinations are important as well. Like for seniors, for example, the shingles vaccine, the RSV vaccine, to name just a few, pneumococcal vaccine are important. Medication management. So you have a lot of chronic conditions. It's important for a primary care doctor to take care of that as well. Make sure you're on the correct dosages. You need refills. That's important. And, just someone that you want to build trust with as well. With a doctor, you can talk about anything. I've had patients come to me just randomly just talking about life, not just medical stuff. Just talking about life. They didn't have anyone to talk to. And they were just sitting there just talking to me about life, and I was just listening to them.
So you don't feel rushed. I think a lot of seniors
with my
are like
patients.
that. Right. I think a lot of people like that. They're like, you know what, we've got 50 people out there. We got to move on. Right. So at least you can feel you can bring some stuff up.
You feel more at home, and I could advise you the best way I can and lead you to the right resources. So a lot of those things are very important. Chronic care management. So high blood pressure, high cholesterol, diabetes. It's really important to have a primary care doctor continue to manage those as well, and stay on top of those, and also help you, show you ways to prevent it from worsening.
See, that's what I like about going over all the pills. If you can even bring them in and go, look, I'm on all this.
And I love that. I love when patients bring in their pills or they bring in a list of their medications. It's really nice. I love that. So we can go one by one. Okay, this is for this is for that.
Right.
And a lot of times I ask patients, are you tolerating these medications okay? Do you have any side effects? Most of them, will say, of course not, they're okay with it. But some would say, yeah, doc, I'm feeling somehow with this. I'm like, okay, we have alternatives we can try.
See, that's what I like too, alternatives all the time. It's always not about pushing pills. I mean, if there's something else, or we can go off one of these or lower a dose on something, maybe you'll feel a little better too. I understand you have to be on some. I get that. But just knowing that I don't need a pill for everything.
Yes.
Yeah, because there's other things you can do, or take more vitamin of this or that, or take fish oil or whatever.
That's right.
That's what they're telling me, especially for cholesterol.
That's correct. Yep. Fish oil is good. Yep.
Take whatever.
It is.
Do you know how huge those pills are?
They are huge.
Have you ever seen the fish oil?
Yeah.
Huge.
Why do they have to make them so big?
I don't know. But other sources of omega, since we're even talking about that, other sources of omega-3 fatty acids are fish. So if you're like fish, like sardines, salmon, walnuts, those too have good omega-3 fatty acids. So some patients prefer food-wise, so those are some options.
Mark likes sardines.
Yeah,
You said you kind of liked them.
I like them if there's nothing better to choose from.
But you know what else Mark likes?
What do you like?
Spam.
No. I don't know if I like Spam. It's been a long time.
You were going to fry it up with what
I know, because that's Chief Lally brought me some, and I still have to fry it up. And I'm going to eat it. I haven't determined whether I like
Maybe
it or not yet.
you probably shouldn't eat it though, right? Probably not good for you.
Spam?
not.
No.
Yeah, probably not.
Sure it's not.
If you do just little, not too much.
Yeah.
Yeah. Well, we have Sweet Sandy on YouTube saying it's so hard to get an appointment right now, especially with a specialist. I've been waiting since mid-March to schedule with my GI doctor. I'm not sure if that's what
Is
she's
that
saying.
gastrointestinal?
Oh, yeah.
Yes.
My appointment is in mid-June.
Wow.
And she's been waiting since mid-March.
It really,
yeah.
it really sucks with like
Yes.
specialists. It's a lot of times when I place referrals, unfortunately, it's out of my hands because most of them, yes, they are booked. All we can do is maybe look for other doctors that might find, have sooner appointments.
Cancellation.
Yeah, or
but
cancellations, unfortunately. But yeah, there is a long wait for a
I
lot of
don't think there's a
specialists.
lot of GIs in Elgin.
There really isn't. There
I
really
think
isn't.
that's the other issue. You know, when you only have a handful.
Yeah. Yeah.
Yeah.
I think I've heard about that. So there's nothing really she can do. Maybe
Pretty
just call and
much.
see if she can get on a wait list or a cancellation list. I
Yeah.
should say.
That's correct. Yeah.
Yeah, that's what I always say. Put me on one. If somebody cancels, I'll take it.
Yep.
9:32, you want to take our halftime break here, Cherie?
Yep.
Okay. Coming back, we'll have more of Cherie's Senior Showcase if you want to call us. It's 847-931-1410. We'll check more YouTube comments or questions. The doctor's here, Dr. Kayode, for another half hour or so. So give us a call. And we have trivia coming up in the second half of the show, too. Keep it right here on WRMN.
WRMN has been serving Elgin and the Fox Valley for 75 years, featuring a combination of local news, information, and entertainment in the mornings, followed by the radio shopping show for 5 hours each weekday. The first shift with Marky B starts your morning at 6 a.m., and it's always fun when Larry Jones is a part of the show.
Maybe we need to get a radio intern in to help.
Maybe so.
Somebody that you won't have to pay and you can treat him tough.
I can haze them.
Can't haze, you'll get fired. Remember that guy from Northwestern?
Yeah.
Gone.
Did he really do it?
You don't have to really do it. If somebody says you did,
Yeah.
good enough. Maybe I'm going to accuse you of hazing me. I don't have to prove it.
And then there'll be a lot of people that come out of the
And
say,
say,
I also hazed
I
him."
remember when Mark hazed me. I've been hazed.
Mark hazed me back in 2012.
2012. I remember in Memphis one time. He was really mean to me.
It's first shift fun and information in the morning, combined with the radio shopping show to save you money. And you get it right here on WRMN AM 1410, WRMN 1410 Radio on Facebook, and WRMN1410.com.
Searching for a financial partner that truly has your best interest at heart? Join KCT Credit Union, where they're more than just a bank. They're a not-for-profit financial cooperative. KCT members are owners, meaning profits go back to you in the form of lower loan rates, higher savings rates, and fewer fees. Experience personalized service that puts you first. Become a part of KCT, where your financial well-being is their top priority. Visit kctcu.org. Each account insured up to $250,000 by member's choice. This institution is not federally insured. Discover the authentic taste of Italy at Massiano's Pizza and Pastaria of Elgin. There is one inexhaustible aspect of everyday life that never dulls, namely the simple pleasure of eating and drinking. Massiano's wants to make sure that this is the best part of your day. Visit Massianos.com and sign up to view their special offers all year long. Delivery, carry out, or dine in, enjoy it anyway, because life is good at Massiano's.
Everyone has a community to lean on, a neighborhood, school, kids' teams, where you worship, work out, or any other place or group where you choose to belong. Communities can provide support when you need it, and even when you don't know you do. Like when it comes to preventing underage drinking and other substance use. You've talked with your kids and shared clear expectations, but you're not with them every minute. Your community members, friends and relatives, teachers and coaches, faith leaders, and other important adults in your kids' lives can be your eyes, ears, and a supportive influence when you're not around, reinforcing your messages with your kids and alerting you to warning signs of underage drinking or other substance use. So talk with your kids about these issues and involve the members of your community to help keep your kids safe. Because when you talk, they hear you.
Clocking out? Drive home with the Drive Time Deal with Matt McNeil on WRMN 1410 AM every weekday from 3 to 6 p.m. I bring you the hottest deals in town, the most intriguing stories, and the tracks that take the edge off rush hour. Tune in on 1410 AM. Catch us on YouTube Live at WRMN Radio or stream through our app. I've got the wheel to steer your evening right. WRMN 1410 AM, your home of radio shopping and the soundtrack to your commute.
Rise and shine, Fox Valley listeners. It's time to kickstart your day with First Shift with Marky B on WRMN 1410 AM. From 6 to 9 a.m., join the chatter that gets you clued in with the latest buzz around town. Don't just sip on your coffee. Let Marky B brew your morning with the perfect mix of news, views, and moves. Dial us in or live stream at WRMN1410.com and make your mornings a whole lot brighter. WRMN 1410 AM. We're the voice of the Valley, and we're here to talk.
It is Cherie's Senior Showcase today, and we're talking about senior issues and ER and other options for going to see a doctor and whatnot.
Yep.
And Cherie Ashenbrenner is back here. Welcome back.
Okay, so we're going to ask another question is, what are some simple ways seniors can stay physically active?
Yeah, some ways. Going on daily walks, for example. If you don't want to be alone, walking in groups is a good way of doing it. If one loves to dance, going to dance classes, doing different type of dance activities, that's also another way to stay physically active. Doing some, strength training, so like light weights, so like dumbbells, that too can help. Another good one I love to tell seniors as well is swimming, water aerobics. Yeah. So you're moving your arms, your legs. That's a great way to be physically active. So those are some examples.
Right over here, 2 blocks down, is the center of Elgin, who has a swimming pool and a walking track.
That's perfect.
I think you can do walk the track for free.
You can, yep.
Yeah.
You can run, walk, whatever. It's free for the public, yeah.
Yeah, so all those things are just, important to stay physically active, get your heart moving, do something, exactly.
Gotta move.
Exactly.
Also, May is Stroke Awareness Month. So we were going to talk a couple signs of a stroke. What's happening if you think you have one?
So acronym to remember that's really common is called BEFAST, BEFAST. So B stands for balance problems, if one is having balance problems. E is for eyesight issues, so you start to see blurry vision or changes in vision. F is for facial drooping, so you start noticing like one side of your face is drooping. A is for arm weakness, but I won't just do it to the arm. Anywhere you're feeling weak or numbness, especially on one side of the body or one side of the face or arm, anything like that. S is for speech, so any changes in speech. T stands for time to call 911. So any of those symptoms, those are all signs of stroke. One must call 911 right away and go to the ER.
I mean, I know a couple people who've had it, and time is of the essence when you're talking that.
That's correct.
Because, if you don't get there in time, then you can have paralysis on one side. You'll never get your speech back.
Yep.
Yeah,
it's really important.
So don't hesitate if you think you're having any kind of a sign of a stroke.
Does it take a while for a stroke to build up? I mean, can you start to have symptoms of a droopy face or
it can just come suddenly.
Suddenly,
it could come suddenly, or take its time.
Or either give you some warning for a little while that something's not right.
Yeah, exactly. Yeah. And there's some ways for you to like really make sure to like either prevent or control. Number one, controlling your blood pressure is important because that increases risk of stroke. Control of cholesterol is also important. Non-smoking, so when it's smoking, one should stop because that increases the risk. Obesity also increases the risk as well. Some certain heart diseases like irregular heart rhythm, what they call atrial fibrillation, can increase the risk of that as well. Diabetes as well can increase the risk. So there's like a lot of lifestyle modifications one can do to help prevent it. So diet, like eating a heart healthy diet is really important to help prevent having, a stroke.
Okay.
Yes.
We were also talking off air a little bit on the break though, because I wanted to know, do you and I know seniors would like this too. If you're in the hospital you're at Sherman and you're their doctor, are you going to go see them, or is that a new thing now where they send other doctors and then report back?
Yeah, so if one is admitted to the hospital and I'm the primary care physician, I don't see them in the hospital. There are hospitalists that are hired that will be taking care of them in the hospital. Hospitalists, correct.
Okay.
So then after the visit, after the discharge, I should say, our office will get notified, or it's important for the patient to call the office and say, I need to follow up after my hospital discharge. So then I will look in the chart, see what happened while they're in the hospital, if there are any additional follow-ups, for example, with specialists, or if there are any additional labs or tests that need to be done to follow up to continue on with their care.
Okay.
And then if there are patients that do not have a doctor that were admitted to the hospital, there are people on staff that will help them to find a doctor available that can continue on with their care.
So they had an issue and they're in the hospital and they're like, yeah, and then they'll tell you to follow up with your primary. You're like, I don't have one.
Exactly, yeah.
Okay.
And that's when they'll help you out with that, to find a doctor, yes.
Okay. So you're at 1710,
Correct.
Randall. Now, if you're interested, what's your phone number?
Sure, it's 847-214-5740. So that's the office number.
Say it again.
847-214-5740.
Okay. And then what are your office hours?
So my office hours are usually Wednesdays are my late days, but normally Monday, Tuesday, and Friday, it's from 8 to 4:20. And then on Wednesdays from 9 to 5:40.
Okay.
But pretty much when you call the office, you just say that either if you're a new patient, I would like to establish care with Dr. Kayode. The schedulers will work with them to figure out what times are in my schedule that will work best with them.
Oh, okay. You also on the break said you're going to back to school to get a master's now too?
Yes, I am.
Again?
Because because 11 years of school wasn't enough?
Master's in public health, yes. Master's in public health. Yeah,
a doctor and a professional student.
Yes.
She must really like school. Well, you were saying how many years some of these specialists have to go, though.
Oh, yeah. It's a lot. Training-wise, it's a lot.
We have a phone call.
Okay.
847-931-1410. It's our friend calling us to talk to the doctor today. Our friend, we have many friends, Cherie, but this is wonderful Wilma calling us this morning. Hey, Wilma.
Yeah, I was just, going to talk about what you was talking about a little while ago about the urgent care and stuff. I had to go to, I went to go to urgent care and they weren't open, so I went to Sherman, but they would have sent me there anyway because they had to put me in the hospital. So I had an infection in my leg. So I thought they was checking for a blood clot, and I don't think urgent care does that. And so it's a good thing I went to Sherman.
Yeah,
that's correct. Yes, that is severe.
Yeah, talking about the med list and everything. I like it when they print out. I got doctors that print out everything that happens in there while I'm there, and urgent care does the same thing. I think at my hospital stated got a med list and everything that's upcoming doctor's appointments and everything. I carry one with me everywhere I go. The printouts that they give you.
What do you carry with you?
Okay, it's a printout.
A printout. Okay.
I think she knows what I'm talking about.
Yeah, she's talking about the after visit summary. So after, you go to an urgent care or go to a doctor's office, there's an after visit summary that has a list of, for example, maybe when your next appointment is, a list of all your medications you're taking, if there are any changes, or any doctor's notes, any additional doctor's notes.
Right. And anyway, several months ago, I had a laceration in my leg, and I had to go to urgent care over there, like a Caputo's. I guess that's the same one you're talking about.
Yeah. In South Elgin?
Yeah.
Yeah, and I got that printout, and when that's the one I use. That's the latest one. It's got all the things I got on there.
Yeah, that's the new one.
Yeah.
That's pretty big.
But I just happened to have that with me.
That helped.
Yeah.
That's good.
So they know what was going on. For my last appointment, I think, with Dr. Chawa. So.
Okay. Well, you're doing better now, Wilma?
Oh, yeah.
Good.
And I'm surviving everything.
You have to get down to senior services. Mark misses you.
Yeah.
Mother's Day thing, because that's the day I was in the hospital when I came home that day. But it was later on that day. I went in Saturday night, and I came home Wednesday.
Okay.
So I had to come in and cancel my so someone else could get in.
Well, that's good. At least you canceled. All right.
We'll see you soon, Wilma.
All right, bye-bye.
Okay, bye-bye.
Bye-bye. 847-931-1410. Wendy's on YouTube. She says, thank you for this program, Cherie and Doctor. All good information for me to get to the doctor. I have been putting it off.
Does
says
she need one?
Wendy. Yeah, you need a doctor, Wendy?
We know one.
Yeah, we do. Dr. Coyote's in the house. Yeah.
And I guess they brought us a giveaway for our trivia. And in this bag, it's Advocate Aurora Health little bag. And they said it's a tote. And it's Advocate Sherman Weight Management Clinic. Offers a lifestyle change program which utilizes group coaching. The use of meal replacements and medical supervision is necessary. This program is taught by a certified health coach, consists of two main parts: quick start to take the weight off and maintenance to help you build healthy habits as you focus on behavior change with grocery store foods to promote weight loss long term. This giveaway includes a day on the lifestyle change diet, which consists of 2 entrees, 2 shakes, and a serving of hot cereal. This plan requires you to add 5 servings of fruit and vegetables of your choice to eat along with the meals and shakes, and we've included a bar as well to help you feel it must be satisfied. I think.
So you'll feel satisfied.
In case you need an afternoon pick-me-up. So that is what is in this little tote bag here. So what Mark does now, he comes up with a Elgin trivia question, and sometimes he stumps them. He gets them, takes four callers to get the right one. But he looks frantic over there. He doesn't. I don't know if he's got one ready.
Well, I'm usually a little more clever than this. Let's see. But today, I don't really have a good one. So let's just pick one from the archives here and go with it. Okay. If you want to try for this prize, it's 847-931-1410 to call to win this prize pack that Cherie just talked about. 847-931-1410. And let's see. In 1945, high school students in Elgin were asked not to do this from 4:30 until 6 p.m. every afternoon. What not to do back in 1945? A, hang out at Burns Pharmacy.
Oh, I would be there.
B, ride their bicycles on city streets. C, ride city buses. D, use public payphones. Or E, have a stroke. There would be no doctors available. I had to do something. No strokes between 4:30 and 6. There were no doctors available in that time slot.
Okay.
That's E.
Okay.
847-931-1410 if you want to take a shot at today's question. We have one on hold right now. Let's see who we have here. Good morning. Welcome to the show.
Morning, Michael B. Morning, ladies.
Hi.
Downtown Jose.
Downtown
Jose. Struck out in the last hour. Is going to go for it here.
Okay.
Okay.
Yeah, I very like the show. Very informative, and good luck to you, Doctor.
Thank you. I appreciate that.
Yeah. So what do you think back in 1945, Jose? What were students at Elgin High School, high school students in Elgin, asked not to do between 4:30 and 6 in the afternoon? Hang out at Burns Pharmacy, ride their bikes on city streets, ride city buses, use public payphones, or have a stroke because there were no doctors available?
I'm going to go with A.
A, hang out at Burns Pharmacy, says Downtown Jose. Let's see.
Loser.
Oh.
Oh, no. Good luck, everybody.
You're not a loser, Jose.
You're a 2-time loser.
You're not a loser.
Wow.
Loser.
All right, Jose, have a good day.
I used to go to Burns
You too. Be good.
All right, take care.
all the time. 'Cause
You did?
I was on the south east side. Yeah, I was down below Bluff City Boulevard. I walked there almost every day.
Where was Burns from?
Right
I
on
don't
the
know.
corner of Bluff City and St. Charles.
Okay. So Burns Pharmacy was down there, and you could go there between 4:30 and 6 in the afternoon. You'd be
Good
fine.
to know. I was there.
Yeah. All right, we got another caller.
Okay.
Oh, we had it, and the caller disappeared. So we have open phone lines if you want to try for the prize pack here in the final minutes of the show today. It's 9:50 right now, so you have a few minutes to get in.
Okay.
Yeah.
Yeah, because they used to have the shakes there. A little bar was for milkshakes.
Oh, yeah.
Yeah, a lot
yeah.
of candy. It was right next door to the Stop and Go.
Yeah, which is still there.
It is still there.
Wow, okay.
Yeah. All right, so we don't have, nobody's if they're afraid to call?
Well, Wendy's on the line now.
Okay.
You know, she needs to go to the doctor.
I know.
But she has time for trivia. She has time for trivia, but she can't go see your doctor.
Okay.
Good morning, Wendy. How are you?
Thanks, Mark.
Hey, I'm sorry I had you off the
Okay.
air. You're on now. Hey, Wendy.
I know. Hey, I'm going to guess B.
B? Okay. Let's see. Ride their bicycles on city streets is her guess. Let's see.
Loser.
Oh.
Mark always knows
Wendy.
them, I tell you.
Oh,
Usually
well.
takes 4 callers on this show.
I know. I'm not sure why.
Loser.
But Wendy
Thanks,
comes up
Wendy.
empty. Thanks, Wendy.
Bye.
All right, 847-931-1410 if you want to join us.
I know. What happens too, though, is if they win, then they get put in jail, and then they can't win another prize for,
For
a week,
2 weeks.
For 2 weeks.
Oh, I
Yeah.
So they're being very careful.
Some people pick their spots as to when they want to win and lose. Because if there's something good I give away on my morning show and they get today's prize, they might be left out.
Right.
So, yeah.
Yeah,
We'll see.
We'll see. Okay. Well, we'll wait and see if somebody else gives us a buzz that can
Okay.
win this. Okay, so let's just conclude. So when you are like a general primary, right? So that
Correct.
includes everything.
Mm-hmm.
Whatever, and then if you can't do it or you need to send them off to the cardiologist or
Correct.
or
I'll refer them to
you will
specialists.
refer them to the specialist.
That's correct.
Okay. And so where are, like right now, if someone would call in, you can probably get in?
Mm-hmm. At least within, I would say the wait is about a month now.
Oh, you're at a month still too? Oh,
Mm-hmm. At
goodness.
least a month off, but it's better than my other
3
colleagues that are way more than that.
Yeah, from
Yeah.
March till June.
Exactly.
Okay, good
Yeah.
to know. Can you give us your number again?
Sure, 847-214-5740.
Okay. And that is for Dr. Elizabeth Kayode.
Kayode.
I always want to say Kayode because
I know, it does look like that.
Kayode.
I think that's the way you really say it. I think she likes Coyote. So she said, you know what, I'm going to start saying my name that way because everybody knows Coyote.
But I have to be honest with you all, in my native tongue, the
Yeah.
pronunciation is Kayode.
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 Okay.
Kayode.
But to easily, for patients and everyone to say, or I mean, easily say it, it's Coyote. Coyote. I just say Coyote.
Okay.
Yeah.
That's what I was thinking. Mark did good this morning. He was
Yeah.
all over it.
So as a general doctor then, and you say you refer people to specialties if they need one, but as a general, you have some knowledge in all the different areas, right?
For example, like chronic, like we've discussed, like chronic disease management. So diabetes, I can manage that. Hypertension, which is high blood pressure, I can manage that. High cholesterol as well. Low thyroid levels, hypothyroidism, I can manage that as well. So there are some things I could do myself. But then there are some things, well, I do need a specialist for further evaluation.
Yeah.
And then I will refer at that point. But most things I could do myself, manage myself.
Yeah. Cool.
Yes.
Well, we have another one that wants to try
Okay.
trivia here. It's our friend sidekick Susan on the phone
Okay.
now. So let's see. Good morning, Susan.
Morning.
Hello, Susan.
Morning, ladies.
Hello.
Morning.
How are you?
I'm doing pretty good. What are the last 3 choices again?
The last 2 choices, let's see, are what did we have so far? Riding city buses is C, and using public payphones is D, and E is no strokes between 4:30 and 6. There were no doctors available in Elgin between 4:30 and 6 back in 1945.
I'm going to go with D.
D. I'm glad you didn't pick E.
Yeah.
You picked D. Survey says
Loser.
Oh.
no. Well, thanks for trying, Susan.
You're
Well,
welcome.
All right,
only
take care.
one
For shifters. Morning.
Take care.
There's only one answer left.
That happened last hour too.
I know.
Wow.
It happens every show that I have.
Crazy. These are
It's
great
always-
questions.
It's always the 4th one.
Yeah.
Poor
All
people.
right. So open phone
Well,
lines
we
if
know-
anybody wants it.
That's right, because there's only one choice left.
Yeah.
Okay. Take it off. We'll see if anybody calls us. All right. So what do we have? 5 minutes left?
Yeah.
Okay.
Well, about 3.5. Yeah.
3.5 minutes.
Yep.
Okay. So, I think, is there anything else that you want to end up with? Or I have a couple other things that I can send, talk about, to let people know what's happening.
Sure, you could let
You
them
got
know.
no, okay. Let's go with, I think that the Elgin Township, too, is a little bit low on their pet food again. They put that kind of like an urgent thing out on Facebook the other day. So
Yeah.
they're always looking for donations of cat and dog food for seniors 65 and older, only new and unopened bags and cans. So just take them over to 729 South McLean Boulevard, Elgin Township, 8 to 4, Monday through Friday. And if you need it for your own pets, call them. Definitely call them. And if you can't get it, pick it up. They will bring it to you.
Yeah.
Yep. And then always don't forget about Anderson Humane. I did have a senior who said they had just put down their 15-year-old dog. She said they're missing it bad, but they're 80, and they didn't want to get a new one or a puppy because they don't want them to outlive them, right? And I understand that. So, but again, if there's a dog maybe you could foster or an older pet, that they'll pay for it. So they'll pay for the food and any vet bills and any of that. So, that's something to think about.
Yeah.
I think that's a very nice program. And then you can also go walk dogs over there. They're always looking for walkers.
Well, yeah, I think that's what the Duchess of Douglas up here does. She lives right above the radio station. She goes to Anderson like once or twice a week. So.
And keep in mind, too, that if you are a senior and maybe you fell and you're in rehab and you need someone to take care of your pet for a few days, or you got home and now you can't walk it, people will come from Anderson and help you take your pet to a vet or give them food or change out litter boxes and things like that for you. So
that's a really good service, because I think maybe that helps someone decide whether they still want to try to take on a pet or not, because they know that, man, maybe I can't do it all the time. So then,
but you want one, and you're lonely, and you want to have one, but you're just thinking your age and I don't, because what happens if something happens to you, then what happens to your dog?
Right.
Yeah.
Well, it looks like Rosemary might want the prize.
Okay, come on, Rosemary. There's only one answer.
Yeah, hi. And so, I don't know. I'm just guessing the no doctors after 4:30. I don't know if that was taken or not.
No doctors, no strokes after 4:30. Hell yeah. We're going to make you the winner anyway. You're wrong, Rosemary, but we're going to make you the winner anyway.
Right. The real answer was what? No payphones? Can't use a payphone?
No riding city buses.
Oh, no riding city buses.
No riding city buses between 4:30 and 6.
That was the other answer. Okay, like I said, I just turned in, and I thought, well, let me give it a try.
So, Rosemary, how do you get this prize? Do you come down, or does Mark give it to you? How does this work?
Yeah, you come down, right, Rosemary?
Yeah, we come down.
All right.
What is the prize? I don't even know what the prize is, but I'm glad I won it.
I don't know. Mark's got the radio or the music on, so.
Yeah, we're only about 15 seconds left in the show, Rosemary, but it's got a bunch of good stuff in a bag.
Okay, that's fine. Thank you very much.
Okay, Rosemary. Bye-bye.
Okay.
Bye. Bye-bye.
All right, bye-bye.
All right, Cherie, thanks for a great show. Thanks, Doctor, for being in.
Thank you.
Hey.
Sonar's got Out to Lunch coming up at noon. Keep it right here on WRMN on this hot Tuesday.
This is McGruff the Crime Dog, and I need you to help me take a bite out of crime. Counterfeit products are popping up everywhere. Fake sneakers, fake cosmetics, and even fake pills. Crooks are selling counterfeit versions of just about everything. Last year,